Thank you, Senator, for joining us today. It's helpful. Given that the health care reform will add 47 million people to the pool of insured individuals, how will the health care system be able to address the inequities in access, given the shortage and unequal distribution of providers and facilities that are inevitable with this increase in the covered population? And most importantly, how quickly can that be addressed?
Well, that's a very good question. I think realistically, it's going to take several years, maybe most of a decade, to train up the people we need, the additional people in the healthcare field, to meet the needs. The experts that have talked to us in our committee say that folks who are uninsured today get about 60% as much in the way of health care services as people who are insured. They just get the health care through emergency rooms or some other way that in most cases is not paid for. So there will be an increased need for health care services if we cover more people. There will be an increased need for health care providers of all kinds. And clearly there are shortage areas that need to be given priority, and that's going to take a while. It's a little bit of a chicken and an egg situation. Some folks have suggested, well, why don't we solve that problem before we expand coverage? Well, I think you got to do them both simultaneously.
All right. We're going to go to group 9, and if I've been reading the sign language from that table correctly, we're going to hear from Mindy Grossberg on Medicare and Medicaid. Thank you, Senator.
Thank you.
How will reform affect Medicare, Medicaid, and other public programs?
Well, as I say, in the bill we're working on the Finance Committee, we're going to great lengths to not adversely affect Medicare beneficiaries with cuts. There are going to be some cuts to providers, and essentially some of the savings that would be involved in this legislation would be implementing some of the recommendations that MedPAC, the MedPAC is the advisory panel that makes recommendations every year on ways to maintain quality, improve quality, and cut costs in Medicare. They make recommendations every year. They've never been given that much attention in the Congress, and we are trying to implement quite a few of those. So that's Medicare. Medicaid, the plan would be that more people would be covered by Medicaid. And the question of whether there is additional financial burden on the states as a result of that has not been decided. I think, as many of you know, New Mexico, all states, I think, on average, the federal government pays about 57% of the cost of Medicaid, and the states pay the remainder. In the case of New Mexico, it's 72% most of the time. The federal government pays, and the state pays the remainder. And as to this expansion population that would be involved if we're able to pass this legislation, clearly the federal government would pay the lion's share of any cost involved with that, but the decision as to whether the federal government should pay it all, or should pay 90%, or should pay some other percentage has not been made.